Hi everyone, and welcome to the latest in our Inside Health series. Today we're getting into the topic of managing pain, and specifically pain that affects muscles, bones and joints. Unfortunately, living with pain is a really common reality for many people, whether it's caused by a specific long-term condition such as arthritis, a short-term issue caused by an injury, for example, or simply just wear and tear due to getting older. And it can impact so many different aspects of our life, from our sleep and our mental health to our ability to be active and even just enjoy normal everyday activities. So today we're going to look at some ways to manage pain, cope with it and reduce the impact that it has on our lives. And I'm joined by some brilliant guests to help me do that. First up is Adam Thomas, a recognisable face to so many of you, I'm sure, from his time on shows such as Waterloo Road and Emmerdale, and of course his recent appearance on Strictly Come Dancing. Adam was diagnosed with arthritis about 18 months ago and has been on his own journey of living with and managing the painful symptoms. So we'll be speaking to Adam all about this very soon. I'm also joined by Sarah Griffiths, who's a physio at Physioline. She's the lead therapist there for Bupa, and she's going to give us her clinical expertise on ways to manage our pain and get ourselves stronger, as well as bust some myths about treatments and supplements. And of course, we'll be spending time answering your questions. So please send in questions for our experts on the chat and stay tuned for that later. So firstly then, over to you, Adam. Thank you so much for joining us today.
Thank you for having me.
You're an actor, TV presenter, dancer.
Dancer? I don't know about that.
Well, you certainly are.
Did you see me in Strictly?
I did. You're brilliant, absolutely brilliant. And you're a dad of two as well. But as I mentioned just then, you were recently diagnosed with arthritis, specifically psoriatic arthritis in your case, and that can affect the joints, make them stiff, swollen and painful. So let's talk a bit about your diagnosis. How old were you when you got diagnosed?
I think I'd say about 34. I'm nearly 36. I know I don't look it.
You don't?
But
you look about 18.
Stop it. But yeah, I got diagnosed with psoriatic arthritis when I was 34. Right. And yeah, it's been a tough old journey from then onwards, but we're slowly getting there.
Okay.
Yeah.
I think a lot of people think about arthritis as something that only affects older people.
Yeah.
And whilst osteoarthritis, the commonest type, does get more common as we get older, there are many types like psoriatic arthritis, rheumatoid arthritis, that crop up in earlier life, don't they? What symptoms did you start experiencing?
Well, I was actually training for like a CrossFit competition at the time.
Right.
And I got an injury in my knees. And several months went by and they just never went back to normal. And I went to the doctors, went to the hospital, and no one really was giving me any answers. And then it was a couple of weeks after that, I literally went to bed one night, woke up, and I felt like I'd been in a fight with Mike Tyson, because my hands, my wrists, my fingers, they were just so stiff and so painful. I genuinely thought that I'd fallen out of bed and broken my wrist. So I went to hospital, had an X-ray, and they didn't pick anything up. Everything was fine. And it wasn't until someone mentioned that I could potentially have arthritis, and I thought, again, going back to what you said, I thought this was something that you got later on in life. Yeah. And so I went to see a specialist, and then I finally got diagnosed. It wasn't until like 6 or 7 months that I finally got diagnosed with psoriatic arthritis, and it's been a journey
since then. How did you feel when you got that diagnosis?
A big relief, to be honest with you.
Because you had an answer.
Because I was in so much pain for so long and no one was really giving me any answers. So to finally say, you've got this is how we're going to manage it now, it was like a breath of fresh air. Yeah. Just because I think, again, mentally, when you're in so much pain and you don't know why, no one's really giving you any answers, it can be quite challenging. Yeah. So to finally get the news that I had psoriatic arthritis, it was the step in the right direction, but obviously there was a long journey ahead, like I say.
And you've mentioned, it was the pain in your situation, it was the pain. What was it like? Where was it? Which joints were affected, and how did that impact your daily life?
I mean, massively. It started off in my knees, like I said, and then it travelled to my wrists and my fingers, and then it was in my ankles and in my toes, literally every joint possible. And, especially being so active, and, I was always going for runs and going to the gym, and then that just stopped overnight, literally. And so it was a huge impact on my life. And again, not just physically, but mentally, it was the most like challenging thing that I've ever had to go through, because, you know, I've also got kids as well. And as you can imagine, you know, you've got to stay active and keep fit for them. So yeah, it was tough. But again, I had a really good family support network around me, and they helped me get through it. But yeah, the pain was unbearable at times. You know, sometimes I couldn't really get out of bed. I had to get my wife to help me get dressed in the morning. Really? You know, my kids would sometimes, you know, help me down the stairs. So yeah, it was challenging, but you know, there is light at the end of the tunnel, thankfully.
Yeah. Well, I think that's perhaps what only people who experience this understand. I'm sure it must have impacted your ability to do your job, but it's just, you know, it's the relationships that you have with your family. When you have children, you know, you were not able we were chatting before we did this, and you were saying you wanted to get up and play football with your little boy, and you just
breaks your heart. You know, your son's like, come on, Dad, let's go and play football. I'm like, I can't. Sorry. It's tough, you know, and you know, you see it in your kids' eyes when you go to pick them up and you're in pain, and they think that they're causing the pain, and it's like, it's not like that. It's nothing to do with you. But they, you know, they were young, but then they got, you know, they learned how to deal with it just as much as I did. And you know, I'd sometimes pick up a cup and he'd get it for me, or you know, he'd open up the jar of jam for me, just little things like that. And you know, he'd just really help me out, especially my older son Ted. He was you know, an absolute gem from the start. So it's just important to have, you know, a family around you, but also for them to understand what you're going through, because with arthritis as well, because it's not a physical condition, you can't see it. It's quite a lonely disease, because you are in pain and no one can necessarily see the pain that you're going through. And also, you don't want to go out your way and tell everyone, you know, I'm not, you know, like a sob story sort of thing. So it's just, you know, you just got to keep it to yourself sometimes. But what I have found later down the line is that, you know, the more that you talk about it is the most important thing. And I feel like, you know, more people need to be aware about the condition, and that it's not just young people that are going through it. So
because you're in pain and you've had this period of life being in pain, how have you managed to cope with it day to day? You know, what maybe tips and tricks might you have for other people? What can they learn from you?
I mean, you know, with arthritis, everyone's different. But for me, I mean, I've got every wrist strap under the sun. And what's so good about these wrist straps is you can, you know, I feel like heat helps with my joints quite a lot. But also you can put them in the freezer as well, so I put them on quite often. It's just finding out what works for you and what doesn't. And again, I've got a blanket that I put on when I get into bed. This heats the bed up just to like warm the joints up, and I just feel like little things like that just make a big difference.
Can diet help as well?
Yeah, I suppose so. I mean, you know, there's all sorts of diets out there, and again, being so outspoken about my journey, you know, you can sometimes get inundated with information about, you know, you shouldn't do this, you shouldn't do that. But again, you've got to do what's right for you, and it's about trial and error. And you know, trying different foods and what's causing flare-ups, what's not causing flare-ups, and just trying to do the best job that you can do. Listen, it's not going to happen overnight, but again, you just got to try and do the best job that you can do.
And I think there is so much information, because there's information from healthcare professionals, then there's loads of information online, and I'm sure many family members and friends will sort of chip in with their bits of advice, and then there's the social media.
Exactly.
Loads of things that are said to be cures. And did you try anything or really invest in anything that didn't work?
That didn't work. I mean, I tried pretty much everything.
Did you?
Yeah, I did. But for me, it was the main important thing for me was exercise. And I couldn't necessarily go to the gym. I couldn't really run. I couldn't lift weights. And again, like, I wanted to try and involve my kids as much as possible by just doing activities with them. And I think swimming for me was the key thing, because I could go swimming, but also I could be there with the kids. It's something that we could do as a family. And so, I really found it beneficial for my pain, but also just the quality time with my kids, because you sometimes miss out on the activities of playing football and you know, doing these fun things with them. So we just try and went for swims as much as possible.
Yeah, that's a great thing to do. And how are you doing now then?
I'm really good.
You're sat here, you look great.
I'll stop it.
Looking 18 years old.
Yeah.
You don't look like you're in pain.
No, listen, I'm in a little bit of pain, but as from where I was to where I am now, huge difference. Right. Huge difference. And I don't take anything for granted anymore, because I know what it's like to you know, not being able to go for a walk and being in pain, or going for a bike ride. So every time I go to the gym now and I'm getting a sweat on, I'm going for a bike ride or a walk, I just really embrace it now and just enjoy every minute of it, because, you know, you just never know when these things are going to get taken away from you. And it's the small things that we necessarily take for granted, and I don't want to take any of it for granted anymore. So yeah, fingers crossed we're okay for now.
Good.
Yeah.
Thank you, Adam. Thank you so much for sharing your story, and I'm sure that there are many of our viewers that will find that very relatable, and it's great to hear that you're feeling much better now.
Thank you.
We'll be putting some of your questions to Adam a bit later, so please do stay tuned for that. Now, Adam, you mentioned that exercise is something you do to help you manage your condition and cope with pain. And it's actually true that for most people, strengthening your muscles and becoming physically stronger is one of the best things you can do to help your body cope and manage muscle and joint pain and stiffness. Now, that might sound a bit intimidating and even sound counterintuitive when you're experiencing pain, but Adam and Sarah actually met up yesterday to show us a few simple ways we can all work on our strength. So let's have a look at what they got up to.
What's our first exercise?
Okay, let's start with a simple squat. So I want you to come onto your mat. You're going to bring your feet towards the outside and just turn your feet out to where feels comfortable. So when we're doing a squat, we really want to think about our position. So you want to put the weight to the back of your heels. Imagine if you're going to sit down on a chair and avoid your knees coming forwards over your toes. Okay? For this demonstration, we'll bring our arms out in front. Let's go. As you stand nice and tall, squeeze the muscles at the front and the back of the thighs. Shall we go again?
Yeah.
Perfect. We can make this harder by adding a dumbbell. So if you just want to pick one up for me, if you just want to hold it nice and close towards your chest, again, same posture. Okay, off we go. So adding the dumbbell is adding that increased resistance that we talked about to make it harder and bring more strength towards our joint.
You can really feel the strain with the weight, can't you?
Yeah, a little bit of weight makes a difference. And you don't have to use a dumbbell. You can use equipment from around the house, such as a tin of beans. Okay, let's make it easier. So I'm going to bring in the chair and I'll get you to demonstrate this one. So if you just come to the front of your mat, and if you can take a seat on the chair. So this is a really nice adaptation to make it easier. So I want you to start with your feet hip distance apart, bring your heels towards the chair, arms across your chest. So a sit to stand without using your arms really works our lower limbs. So technique here, I want you to bend your weight forwards and then stand up, push through the heels, squeeze back of the thighs, front of the thighs and your glutes. Lovely. When you're sitting down, take it nice and steady. Perfect.
Perfect.
Great.
Love that.
Okay, next exercise. Have a stand up for me.
Okay.
So let's move on to a bicep curl. So this is a really good exercise to strengthen our arms. So let's grab a dumbbell. In fact, grab two.
Yeah.
Perfect. So again, you just want your feet hip distance apart. Okay. Try and think about balance across the full foot. We're going to just relax our arms down by our side. So simple bicep curl. We're going to bend the elbow, just bringing the weight towards the shoulder. So yep, you can do a single bicep curl, or as Adam's demonstrating, you can do both arms at the same time. Okay, or you can even do alternate. Okay, so we're looking at providing strength to both the elbow and the shoulder here.
Nice.
Perfect. Okay, let's try a tricep exercise. So just place one dumbbell down onto the mat. So again, you can do this in a seated position to make it easier. Okay, but let's start in standing. So I'm just going to get you to hold the dumbbell with both hands, bring it behind your head and gently lower behind. You're going to extend your elbows up towards the ceiling and then slowly lower down. Good. Let's go again. So extend up towards the ceiling, thinking about straightening the arm and gently lowering down. Perfect. I'll demonstrate how you can make this harder. Okay, so you can use two dumbbells. Okay, and this time bringing both arms behind the head. Okay, gently extending the elbows and gently lowering down. So using two weights at a time is increased resistance and makes things much harder. Perfect. Okay.
Amazing, thank you.
Let's move on to a heel raise. Okay, so I'll demonstrate using the chair, which is an adaptation, and I'll get you to do it unsupported. Okay, so I'm just going to place my hands onto the back of the chair. Ideally, you want something around the height of your pelvis. Okay, bring your feet hip distance apart. This time you're going to bring the weight to the front of the balls of the feet, okay? I'm going to lift the heels for a count of 3. Off we go. 1, 2, 3, perfect. And 3, 2, 1 as we lower. Let's do another rep. So here we're really looking around strength and stability around the ankle and the knee. So to make the calf raise harder, we can simply use some dumbbells to increase the resistance.
Sarah, thank you so much. They seem really easy to fit in every day, and I think the message is to stick with them and they could have a really big impact.
That was great, guys, and it just goes to show how simple it can be to work on our strength and support our bodies, and that you don't need tons of equipment or to be in a gym. Okay, so now it's time to chat to Sarah, Bupa's Physioline lead therapist, and we're going to look at some of the common ways many of us might try to manage our pain and get Sarah's expert view on them, and maybe do a bit of myth busting as well to help separate fact from fiction. So Sarah, I think let's start with supplements. There are so many products out there that claim to help alleviate pain, keep joints supple, help us build strength, and I think if you're in pain, suffering with an illness, then if anything is going to work, you maybe want to give it a go. But a lot of these products are very expensive as well, and in lots of cases they might not actually be needed. So I think the first question, are there any supplements that we should be taking that are really proven to help with things like joint pain, joint mobility and building strength?
Yeah, so as a physiotherapist, we don't always specialise in supplements, but I do end up having conversations with patients around sort of 4 key things, which are vitamin D, glucosamine, turmeric and protein, or sort of protein shakes.
So what about vitamin D then? We all should be supplementing with vitamin D, especially in the winter months, shouldn't we? What's your view on that one?
Yeah, absolutely agree. I think we know that vitamin D helps us to absorb calcium, which keeps our bones strong. As we get older, sort of our bone density can reduce. So, you know, making sure we have the correct amounts of vitamin D helps us to keep strong.
And if your patients have things like arthritis then, do you recommend they take more than the standard 10 micrograms, or do you recommend they take it all year round?
Generally take it all year round, and
Yeah.
if you do need any more, it really is speak to your GP. We know that conditions such as rheumatoid arthritis, they can be more deficient in vitamin D, but again, a medical professional will guide you on that.
And then you said glucosamine, which is an interesting one, because I remember when I was first a GP, we used to be allowed to prescribe that on the NHS for joint pain, but then a point came where we weren't able to anymore. So what's your view on glucosamine?
Yeah, so it was really mixed. So like you've just said, originally they thought there were some benefits and now there's not as many. However, 1 in 5 people in the UK still take glucosamine.
Do they? Gosh.
It's still something that patients will regularly speak to me about.
And I think, you know, I often get asked about this as well, and it will work for some people, won't it? Because the evidence doesn't tell you how it will impact you as an individual. So is it something you've tried, Adam?
Yeah, I think I've tried pretty much everything that I can do, but again, it's been about being consistent with it. But again, I don't really do that much research into it. I just know that people tell me to take it, and so I'll take it. I mean, what actually does like glucosamine do exactly?
Yeah, so as we get older and natural with age or long-term conditions, we can have a breakdown of the cartilage in between our joints, which can reduce our mobility and strength and flexibility. So there was some research that said glucosamine could kind of help that process slow down and provide more sort of joint mobility. However, like Dr. Zoe was explaining, the evidence base isn't always there.
Right. But then some people do benefit. So it's a tricky one. What I end up often saying to patients is, look, you know, if this is something that is potentially affordable to you and you want to try it, give it a go, you know, buy it, but be regimented, take it properly and keep a diary of your symptoms. So after a couple of months, you can really make an accurate judgment as to whether it's benefited you or not. If it has, great. If it hasn't, you know, don't waste your money.
Move on to the next.
Yeah. Which is turmeric. So what about turmeric then?
So it's a natural anti-inflammatory, so something that you can just incorporate really easily into diet. You can see sort of turmeric shots or drinks. Again, it's something that see if it works, but it's relatively easy to get and relatively cheap if you did want to try it.
They don't taste the best though, do they?
No. That's why they do them in shots.
And then the last one.
Protein.
Protein. Oh yes, protein.
Yeah.
Protein and protein shakes.
Yeah.
Very popular definitely amongst people who are trying to build muscle in the gym just for gains. But what about for people who are trying to build strength, you know, to help them combat a chronic condition?
Yeah, I think somebody sort of, like you said, who isn't a sports person or an elite athlete or regularly training in the gym for muscle strength and gains, you can actually get enough protein from a really balanced diet. So eating, you know, balance of meat, fish, tofu, nuts, a portion around the size of your hand. We need about sort of 0.75 milligrams per kilogram, so about 0.45 for women and about 0.55 for men. So you can get that from a balanced diet.
So what would that be, like a chicken breast?
Yeah,
roughly
so
per day?
Yeah, and other things. So like we said, you know, you want nuts in there, fish, and if you don't eat that, tofu as well. But yeah, roughly the size of the palm of your hand.
Okay, all right. Okay, great. So supplements then. So vitamin D, yes. Glucosamine, maybe give it a try. Turmeric, no harm in whacking a bit in. And then protein, probably for the typical person, if you're eating a well-balanced diet.
You don't always need it.
You may not need it. Okay, that's really helpful. Sarah, what about hot versus cold therapy? You hear people say put, you know, ice packs on, put heat packs on. Yeah. Which is best, or is it a bit of both?
So just like you said there, it is a bit of both, and it's not really about one being better than the other, and it can often come down to preference. We just need to consider with like an acute injury in the first sort of 3 days, we don't want to be adding heat to the area. If it's already inflamed, that can increase inflammation, so we want to avoid that. But then going on from there, there's evidence for both. So it's really about trial and error, see what works for you. I know you mentioned earlier that sort of heat was beneficial for you before you got into bed. And with
it feels better as well. It just feels so much better. But again, like it depends how you're feeling on the day, I suppose, doesn't it?
Yeah, definitely. And some people use what we call contrast therapy, which is a mixture of both. And again, there's evidence for that as well. So kind of doing 10 minutes of heat, 10 minutes of ice. So again, it really is about what you find improves your pain and joint stiffness.
So something about that intuition, isn't it then? If, you know, if it feels like, even though you might be being recommended to put an ice pack on it, if you think, oh, actually, I just don't want to, it doesn't feel right, but heat would feel lovely, then be guided by what feels right at that time.
Definitely.
It might be a bit of both. Can we discuss ice baths, please?
We can indeed, yes.
They're everywhere. You know, everyone's talking about the benefits of them. I don't know if you've done them, Adam. Have you done ice baths?
I got one, yeah. But again, it's about being consistent with it.
Yeah.
I was like, I'm going to do this every day, but I've only done it once.
Well, there's loads of different benefits potentially of them, but thinking about coping with pain, what's the evidence there, Sarah?
Yeah, so again, there's been lots of research, and again, it can be mixed, but generally to improve overall well-being, perceived pain levels, joint stiffness and muscle pain. But again, it's what works for you, and incorporating it into a daily routine can be difficult. Ice baths are usually around sort of 10 to 15 degrees, and some people add additional ice to make it even cooler. So it can be a big shock to the system. It's really important to speak to your GP before you start cold water submersion, just in case you do have sort of a heart condition or any other sort of medical conditions. And to see if that's the right thing for you. Again, as we've discussed previously, sometimes heat is better, but it really can depend.
And can you get the same benefits by just simply having a cold shower if you don't want to invest in all the stuff?
So when people ask, or patients ask about cold water submersion, I'll often say, if you've never done it before, look, starting with a cold shower is a really nice way to introduce it gradually. You can lower your shower to around sort of 15 degrees anyway, and you can start gradually, sort of 30 seconds, and build it up. So you really don't need to buy a big fancy ice bath that you see on social media.
Okay, and I think, yeah, really important advice though, if you do have a pre-existing heart condition, then do just get checked out by your GP first of all, or do it just very, very gradually, bring it down gradually towards that 10 to 15 degrees. And finally, Sarah, probably all of our favourite topic here, medicine, movement as medicine. Is exercise really genuinely the best thing that we can all be doing for our joints, whether we have painful conditions or not?
Absolutely. So I'm a Pilates instructor and a physiotherapist, so that is absolutely my mantra. I often, you know, Joseph Pilates was the founder of Pilates, and he said change happens through movement, and movement heals, and I absolutely believe it. You know, movement, keeping our joints supple, keeping them strong, is the best way to kind of cope with short or longer term conditions.
And I think the word movement is really helpful, isn't it, actually, because exercise puts a lot of people off. Even I think sport puts people off, exercise puts people off, but movement just feels a bit more achievable?
Absolutely, and the Chartered Society of Physiotherapy actually did a recent campaign called Love Activity, Hate Exercise, and it was really looking at reframing, just like you've said, that word exercise into thinking about movement or activity, and as you mentioned previously, incorporating it into everyday activities that you enjoy.
But some people who, I mean, let's use Adam as an example, on the days when the pain is really bad or if people are having a flare-up, is it better to avoid movement or do less movement on those days and do more on the good days? How do people balance it?
Yeah, I mean, as physiotherapists, and when I speak to patients, we really talk about pacing, which is exactly what you've just said there. So if you are having a bad day, don't feel guilty. You need to listen to your body and take that downtime. When you do have more energy and you're having a good day, you want to, yes, do more exercise. But again, it's about gradually increasing it. You don't want to do too much on your good days that can then cause a flare-up. So it really is finding that balance. Something that can really help is kind of keeping a diary of what works for you, how much exercise or activity you can cope with.
And it is really individualised as well, isn't it? Everybody's different in what works for them.
Like you say, you just don't want to overdo it. You know, like on good days, I'd love to go for a run, so I'd do like 5 to 10k, and then the next day they'd just swell up, and then I wouldn't be able to do anything for like 2 weeks. So it's just about, again, listening to your body and doing what's right.
Absolutely.
And does it depend to some extent what's causing your pain as well? So would it be the same or different advice for somebody with a long-term, more chronic condition versus somebody with short-term pain because of an injury?
Yeah, definitely. I think when we're talking about sort of acute or short-term injuries, we tend to follow the principles police and harm. So harm are the things we want to sort of try and avoid, which is heat, alcohol, running or high-impact exercise and massage. And then things that we can do to help, it's police, so thinking about protecting the joint, maybe a bit of short-term rest, optimal loading, so try and get back to activity as soon as possible, ice, compression and elevation. When we're looking at sort of a long-term condition, such as what you've got yourself, we're thinking about pacing as we spoke about earlier, but then I've kind of got sort of top 3 tips that can kind of help introduce that. So really finding an activity that you enjoy. That doesn't have to be at a gym, as you spoke about earlier. It can be home workouts in the garden, or, you know, just you don't need any fancy equipment either. You can use things from around the home, which leads me into the environment. That's just my second top tip. And then finally trying to find somebody to, if you can, like a workout buddy that'll help you keep motivated. A lot of people with long-term conditions struggle to keep going with exercise and have kind of highs and lows, which I'm sure you can relate to. So it's really about finding somebody as well that you can go and enjoy that activity or movement with.
So you spoke about the importance of rest, and sometimes rest is necessary, but if people rest too much, are there harms in not moving? Can that actually make some types of pain worse?
So we want to do as much as we can and keep moving, and like you spoke about pacing, but yes, we know that, you know, if you've been sat in a chair without a long-term condition, you can feel stiff, or, you know, getting up first thing in the morning as we're getting older. So movement really is the key to sort of reducing joint pain, stiffness and muscle soreness.
Sarah, is it ever too late to start exercising? I think sometimes people start receiving advice about moving more when they're a little bit older and maybe they've developed a condition, or, you know, they've got, whether it's arthritis or another painful condition, but they've never been sporty, they've never been active. Is it ever too late to start?
Absolutely not. So as a physiotherapist, you know, exercise is our main thing in our toolkit. So, and it's really safe for all ages. There are benefits of exercising from an early age and throughout your life. As you know, when we get older, we have natural changes to our joints. We can actually get stiffness, etc. But you know, it really is safe for everybody. It can feel daunting though, so, you know, when you're starting a new exercise or returning from injury, you know, it's really about setting some short and long-term goals and gradually increasing your exercise until you feel confident and maybe getting a routine.
The same's true for people who do very little exercise or movement as well, isn't it? It's almost that the less you do, the more you have to gain from just increasing those levels a little bit, whether it's walking around the block or just doing some seated exercise can really give benefit, can't it?
Absolutely, yes.
Thanks so much for that, Sarah. Some brilliant advice there and a few myths busted as well. And hopefully you feel reassured that some of the best ways to manage pain is actually getting moving, and it is almost always safe to do so. Okay, so now it's time to hand the floor over to your questions, which have been flying in on the chat, and we'll get through as many as we can in the next 20 minutes or so. So let's get started. Sarah, the first question is for you. I've been advised to build up my strength to support my back pain, and I'm contemplating yoga or Pilates, but I'm a bit confused which is the better one to do.
Well, I'm glad this question came to me because I'm a Pilates instructor.
Does that make you biased though?
Oh, well, I always say this to patients as well, but essentially there's benefits of both, and again, it can come down to preference. So just a bit about them both. They're both forms of low impact exercise that look to improve strength, flexibility and overall well-being. So with Pilates, we're looking at strengthening our deep core and specific muscle joints using our arms and legs as levers. The really good thing about Pilates is there's different levels to the exercises. So that means if you're new to exercise or you're pacing yourself or returning from an injury, that you can go up or down through the levels, which is really good. You may have seen there's lots of fancy equipment in studios. You don't need that. You can do Pilates at home. You can just use a mat or a towel and equipment from around your house, things like a water bottle or tin of beans, which is really good. So on the flip side, there's yoga. Okay, so yoga is more of a spiritual practice. However, it kind of moves through movement and flow and holding positions. They do a lot of focus on deep breathing, and there's often relaxation at the end of the class. And there are lots of different types of yoga, but one I would recommend for sort of a beginner or somebody with lower back pain is the Hatha yoga, which is a slower paced form of yoga.
Okay, I think, the preference thing is huge, isn't it? Give them both a go.
Yeah,
See
absolutely.
what works for you. And just a reminder to our viewers as well that there are loads of Pilates and yoga classes in the wellbeing section on the My Bupa app. So perfect opportunity to give them a go. And if you haven't downloaded it yet, do so. Next question is actually for me. It says, my doctor has recommended some medication which includes steroids to support my pain, but I'm nervous about side effects. Should I be worried? And I think with steroids, I don't know if you had any steroids at any point, Adam.
Yeah, I had a couple of steroid injections, yeah.
Yeah.
And they definitely helped massively.
Yeah.
It was when I was doing Strictly, the pain was just unbearable at times, and I spoke to them and they gave me a steroid injection, and it just, overnight changed my symptoms completely. But again, it's not something that you can have long term.
That's right, and there's kind of like two different types. So there's the steroid injections which you referred to, which can be injected into a specific joint and can alleviate the inflammation and pain there, but there is a limit to how many you can have. And sometimes for inflammatory conditions, people might be recommended oral steroids as well, a course of oral steroids. And whilst it is deemed for that to be safe if it's short term and not too many times, there is a really interesting and quite frightening side effect profile to long-term steroids, which include all sorts of things like increasing your risk of certain types of illnesses like diabetes and glaucoma in the eyes, weight gain, depositing fat in different areas of the body. They can be very disruptive to sleep, but actually often when people are unwell and they do have a short course of steroids, they make you feel amazing. They make people feel like they're superheroes. So sometimes it's like anything with medicine. It's the doctors, along with the patient, should be weighing up what are the benefits and what are the risks at this particular time. But generally, medicines like methotrexate, like you take, these disease-modifying drugs, one of the aims of them is to reduce the amounts of steroids that people need. So I think to whoever asked that question, you're right to be interested in the side effects and make sure you do know what those side effects are, but have a chat with your doctors about the risks versus benefits, and likely if they're recommending a short course of steroids, you will benefit from them. The next question is for Adam. How do you get motivated? This is a really good one. How do you get motivated to exercise? I struggle with motivation, and I don't have so much
struggles with motivation.
If you know the answer, please let me know.
So how do you get motivated? This person says, I know it would be good for my pain and I need to do more, but I struggle.
I mean, for me, I get motivated just by, listen, no one ever regrets a good workout, do they?
That's
that
right.
feeling when you go to the gym and you come and you're walking out of that, like there's no better feeling. So that's the feeling that I'm constantly trying to chase constantly, because I know as soon as I get in the gym that I'm going to feel amazing after it. But also for my kids as well. Like there's no point being at home feeling sorry for yourself, and I look at my kids and, you know, I want them to, you know, see their dad getting out and being happy again. And so, yeah, my motivation is my kids and my family to make sure that I'm getting out there and doing something for myself. And, you know, by doing so, you know, you make your kids happy and they've got a big smile on their face, so that's all that matters.
And what a great role model you're being for them as well, showing that despite it being difficult and the adversity, you're getting up and going and doing it anyway. And doing something for yourself. You know, I think as parents we often feel really guilty, don't we, that we're doing something for ourselves, but we're setting a great example to our children that it's important to do stuff for yourself. Great answer. What about with your patients? What tips do you have for people getting motivated, Sarah?
Yeah, I think short and long-term goals are really good. So, you know, if you are, say, for example, a runner, you're wanting to get back to sort of a 10K race, setting those short-term goals, tracking it as well so you can look back, see where you started and where you are now and see that progress. I think that's really important. Sometimes it's hard to see that progress. Another thing I mentioned earlier is kind of finding the exercise or the activity that works for you and finding your workout buddy, somebody that can help to motivate you. Yeah,
okay, great tips. Sarah, could you tell us which is the best or safest exercise to do for somebody with osteoporosis? So osteoporosis is thinning of the bones, essentially.
Yes, the Osteoporosis Society suggests 3 principles, so strong, steady and straight, which are really easy for everybody to follow. So when we're talking about being strong, we're looking about our bone strength, our muscle strength, so anything that essentially we're weight bearing through the joints, so a Zumba class or walking or jogging perhaps. Then looking at our steady principle, so really thinking about improving our balance, reducing things like risk of falls, so again yoga, Pilates, Tai Chi, or just some simple balance exercises at home. And then the last principle is straight, so looking at our spinal posture and looking after our spine, so thinking about strengthening our core muscles, our back muscles, making sure we're lifting properly, and with somebody with osteoporosis we want to kind of avoid sort of loading in a flexed position with the spine, so making sure we've got bent knees when we're lifting shopping bags, or maybe avoiding things like sort of a deadlift in the gym.
All right, that's really helpful. Adam, you mentioned you struggle with wrist pain. What helps you most with that?
I mean, going back to what I said earlier, you know, wrist straps, you know, hot and cold, but also I feel like a good massage helps a lot. So I try and get in as many massages as I can. I literally just get them just to work on my fingers and my wrists, just to try and ease the pain as much as possible. But again, the wrist straps and just trying to give them as much support as possible. And yeah, I suppose exercises as well, just little exercises that you can do, just stretching them out in the mornings and at night, I feel really is beneficial and really helps with the pain.
Sarah, have you got any advice for someone with sciatica?
Absolutely. So sciatica is a really common condition. I see it all the time. The main thing people struggle with sciatica is the pain. It can be really uncomfortable and really debilitating. And again, the best thing to do is really do as much as you still can manage. However, sort of 3 top tips would be around sort of pain relief if you are struggling with that. So speak to your GP or pharmacist. We really need to get that pain under control to allow us to move, to work on strengthening our core and our spine. And sometimes the pain stops us from doing that. A lot of people are nervous around taking pain medication and they don't want to come off it, but for a short period it really helps us getting moving. Other thing is adapting sort of daily routines. So a lot of people, like Adam was saying, will struggle first thing in the morning or last thing at night. So things like when you're putting your shoes and socks on, use a shoe horn, really simple. If you're at work, you know, using sort of regular breaks every 20 minutes, get up, have a walk around the office, do some simple stretches, or even something like a sit to stand desk can help. And the other thing I talk about is sleep. Sciatica can often disturb your sleep. Again, pain medication can help with that, but doing some specific and simple exercises before you go to bed. If you wake up in the night as well, try and move, and then first thing in the morning.
Okay, great. The next one's for me. It says, I've recently started a course of medication for my arthritis, but will I need to be on this forever? I'm worried about long-term reliance on medication, which I totally get, because many people, you know, the thought of being on medication for the rest of your life, to some people, they don't like the idea of that, and that might be something you've had thoughts about as well. I think the thing with, depending on what type of arthritis it is, but something like psoriatic arthritis or rheumatoid arthritis, It's not completely 100% inevitable. You'll be on medicine for the rest of your life because nothing is. You never know, there might be a cure one day that we'll find for these conditions. But for most people, it does mean it's likely to require medicine. That medicine may change to a different one. And sometimes people do feel that they really get their disease under control with lifestyle and feel that they can reduce down or even take a break from medication to see what happens. It's not inevitable, but most people do stay on medication. How did you get your head around that one?
I mean, I'm on methotrexate at the minute. I started off with the tablet form, and then there was loads of different side effects for that. But so then I went over to the injection, and I feel like it's worlds apart from the tablet form which I was taking. But again, still a few side effects.
Yeah.
I do worry again, am I going to be on this for the rest of my life? And I think now that I've sort of got my life back, I can go back now and make those little changes to try and, help myself later down the line, so I don't have to be on it, as much as I am now, which is, not where I want to be.
Yeah, I think that risk benefit that determines medication, it will constantly change throughout your life, and I guess nothing is inevitable in medicine. Right, next one's for Sarah. I've developed really painful plantar fasciitis in my foot. What's the best way to relieve it, and will it ever go away? So to explain what that is, that's the fasciitis, it's the tissue on the bottom of the foot, inside the sole of the foot, that connects the heel to the big toe, and if it gets inflamed, it can be really painful, can't it?
Really, really painful, and I think this is something I treat all the time. I think with plantar fasciitis, it can be something that takes a little bit longer, up to a year, but the good news is that with self-help techniques, that can often be a lot sooner. Some people, when they are taking advice and following those things, it can heal sort of within weeks or even months, but it can take up to a year to heal fully. Things we can do to help though, so plantar fasciitis tends to be an overloading injury. So what I mean by that is you've increased your exercise or changed your exercise, so may that be the frequency or the intensity or even the distance of running, and it just inflames the plantar fascia itself. So for a period of time we do need to rest and avoid those triggers. So that might just be adapting how far you're walking or running potentially. And then other things are strength and conditioning. So this is where the evidence base is around mobility around the ankle and knee, strengthening around the ankle and foot and knee, and also stretching. Pros and cons, some people find it beneficial, some people find it aggravates it. So again, trial and error there. Getting a bottle of water, putting it in the freezer, rolling underneath the foot can really help with pain management.
Okay, this is a good question. Have any of the panel tried any alternative therapies for pain management? Can something like acupuncture work? I guess over to you first, Adam. Have you tried anything?
What's the other one? The cups on the back and all. What's this?
Oh, cupping.
Cupping, yeah. So I've had that done. But did I reap any rewards from it? I'm not too sure. Again, we keep using the word trial and error and just finding what works for you and what doesn't. Acupuncture, I believe, is a really good one for inflammation.
Yeah, so lots of physiotherapists use acupuncture as an adjunct to sort of physiotherapeutic techniques. I do it myself, used it with lots of different patients. So the way acupuncture works is sort of the needles aim to stimulate the natural chemicals that are healing our body and aid to help that recover. So it's something we really use in adjunct alongside strength and conditioning, where I keep going back to, but that is where the evidence base is. It can help in sort of the early days as well. So when people really are struggling with pain, they might not want to take pain medication. Some people want to try alternative therapies and they benefit. Again, some people have a more positive effect than others. So again, it can be around sort of trial and error and using it with other techniques really.
And I think something I find really interesting is there are different levels at which you can intervene with pain. So if we think about what is pain, well, there's usually a stimulus, there are chemicals that release, the nerves signal to the brain, and all pain is actually created in the brain. So focusing at the level of the brain, like you might not be able to get rid of the inflammation in the joint by doing this, but things like meditation, cognitive behavioural therapy, and other forms of psychological therapy can really help people at the level of the brain, because your nervous system as well, if you're in pain, it's upsetting, it's annoying, as we've spoken about, it can be heartbreaking, especially if you've got young children and what have you. So sometimes those psychological techniques can maybe don't get rid of the source of the pain, but help how you're able to cope and manage with the pain. So it's another thing another thing for people to consider. Thanks guys, I'm afraid that's all we have time for today, so thank you for joining us, and I hope you learnt something that you can take away that will help you on your pain journey, whatever the cause. A recording of today's event will be sent out to you on email as well, so do look out for that. And finally, a huge thanks to Adam and Sarah for joining us today, and I'll see you next time.